let's talk about the level of personal business. I mean, I felt like I was literally watching a Jerry Springer episode.
That didn't move me as much, though. You can't prove any of that stuff.
I'm not saying you can prove it, but I'm saying that to me is not necessarily what rap beefs are all about, unless you talk about Biggie and Tupac. With that one line, we all know what it is.
Listen, don't bring the West Coast on me.
Most rap beefs are not that personal. I mean, it used to be everybody was a sucker MC. Whoever said sucker MC the most won. You know?
Folks, your exciting new medical career, it's just been hit with a serious illness or injury that stops you from earning a paycheck just when you need it most. Check out what Jamie Fleischner of Set for Life Insurance said back on episode 176 about having disability insurance early in your career.
The real reason to get it early on is really twofold. One is to protect your insurability. So if you are healthy and you can obtain the coverage, you also pre-approve yourself to be able to buy more in the future. So down the road, as your income does increase, you don't have to answer additional medical questions. All you have to do is show that your income is increased and you can buy more benefits at that time. No medical questions asked.
Protect your income, secure your future. Check out setforlifeinsurance.com.
Let's get into me doing night shift, man. I just finished a week of nights. That is tough. But I love nights because nights, there's less politicking, if you know what I mean.
Yep.
I just take care of patients. I operate, and then I sign them out. And then I'm out. I ain't got to talk to no social workers. I ain't got to talk to no case managers. I can talk to families. I can talk to the nurses. I can talk to the ED docs. I can write my notes. And I am out. I love it. But, yo, it puts a toll on me, though. Night shifts. Because there's so many different variables that just get twisted, right? Like, for example, like, when is breakfast? Is breakfast at dinner?
Breakfast is when you hungry.
Right? Is breakfast at dinner, like right before you go in at 7 p.m.? Or is breakfast when it's actually breakfast at like 7 in the morning? Mm-hmm. Like, there's all these different things. I really don't know what to eat, right?
So, hold on. This says Kendrick Lamar's latest diss track against pop star Aubrey.
Yo, he called him out, though.
Aubrey Drake Graham is the number one song in the country, it says. I don't know. I mean, this is not a vetted source.
Everybody.
It's like somebody.
Don't fake it, everyone. If you are who you are, if you corny like me, just claim your corniness. Don't try to be someone who you're not, because eventually...
So you think Aubrey just is like corny?
He's a good rapper. But obviously a significant amount. First of all, he's corny and he has a drive unlike anybody else. So let's just put that out there. And he can rap. But obviously he's pushed up by the industry, right?
Can you rap?
Particularly people who are invested in him. They have invested in him and helped him, grow and stuff. And you have to, like, someone like him, like, normally people like him would fizzle out, right? But he's still here. He's still putting music. Like, what makes him go? Like, he is driven like no other. But yeah, I mean, but that's the way how it played out, though, right? That's the whole cultural currency thing that Kendrick called him out on so many different ways. Like, just, I mean, we can get into it, but...
No, let's not get into it.
Exactly.
That's not what...
Because if you know, you know. Text us at 833-230-2860.
Just text us.
You know what we're talking about.
I know.
You know.
All right, so you came back from night shift.
Oh, man. Yeah, came back from night shift.
When
did
is
mad
breakfast?
operations.
So when is breakfast?
Breakfast for me is when I get home.
When you get
in
home.
the morning. Yeah.
When you get back to the hotel.
But the problem for me is I can't sleep very well when I'm on night shift. Like, so when I get home, when I'm in the hotel, like, they have these, the curtains that, the blackout.
Right, the blackout curtains, yeah.
Curtains and stuff. I can only sleep for like 5 hours.
Why do you think you can't sleep?
I don't know. But that's part of this conversation, actually. Later on and stuff. But it for me, though, the clinical fulfillment I get is not completely offset, but there are some sacrifices that I have to make. So I get a little bit less sleep during the daytime. But when I'm on, and I really like that. So it takes me at least a good 3 days to get back to normal. Right.
And right now you're on what, day 2?
Yeah, day 2.
Yeah.
Actually, no, I'm on day 1 because I finished.
Oh, you finished.
I finished yesterday
morning.
I finished yesterday morning, and then I came
so you're
home.
On day one.
Yeah.
Well, this is going to be an.
How many people listen to
weekend.
the show on night shift? How many people?
This is going to be interesting.
If you're listening right now, you on night shift, tell us when breakfast is. 833-230-2860. I feel like
and
we're like a
what
radio
is
show.
for breakfast?
Yeah, man. The other thing, too, before we get into this episode, shout out to Dr. Bobby Burgess. He put me up on this. You guys may or may not use this. Definitely the people who are self-employed may be using this, but Gusto. Gusto is a payroll software where if you are 1099 or if you're your own business owner, you can pay yourself. And it takes care of everything from not only just paying yourself, but making sure that like all your unemployment taxes are paid, making sure all the taxes are filed the correct way for your state as well as federally. It's amazing. Okay. It's really good. It's taking me a little bit longer to kind of get used to, mainly because for several years I've had a CPA kind of handle that.
You used somebody else, yeah.
And I think I'm at a point now where I'm just like, you know what? I actually do want that level of complexity and control. And Gusto makes it a little bit easy. I think it makes it easier to the point where I feel like I sleep better at night knowing that I can change numbers anytime I need to. So if we need to bring in a little bit more salary, then we can do that. I don't have to ask somebody or email someone, hey, can you,
increase our salary?
Just do it and go from there. So shout out to Dr. Bobby Burgess, who I think if he's listening right now, I need to have you back on the show. I'm going to reach out to him like, yo, you need to come back on the show, because the way how he handles his stuff from, his taxes to Gusto to a whole bunch of different things as being an independent contractor is really good.
Right.
And I think that highlights just in general, if you are an independent contractor, don't just be like a silo. Reach out to other people, talk, don't be competitive. It just only behooves us all if we all work together, right? Yeah. So rather than be a race to the bottom, particularly with rates, if we all work together, if we all share rates, if we all discuss, some of the tips or the tricks that we're using, I think in general, it'll make for a better area.
Yeah. So. No, I agree with you. I think, the industry is going to change, or is changing, I should say. The industry is changing a lot. And I think with the changes that are going on in our industry right now, with people coming in, being more entrepreneurial, it's going to be important to know, like, what is out there, what is out there, what is kind of what is it that they say, take the temperature of the place and figure out, like, where you fit in, how much you can make, and when you're getting swindled.
Yeah. Well, eventually, I'm sure, not eventually, we're going to have to make an episode about this FTC non-compete type thing. Eventually, we're going to come out with that, guys. I've just been tired, but we're going to do it. I got a lot to say about it. But in essence, like the industry is kind of messed up, right? Because it's like, I can understand if you're in the tech industry or if you're in some type of industry where that company is actually has all the secrets. And they don't want you leaving and taking those secrets and going to another competitor. But what's the secret in medicine?
Right.
Like, you have the secret as a doctor, and now you can't go to another hospital or you can't go to another facility. That doesn't make any sense. All of this stuff is in the textbook. There's no proprietary thing.
Exactly.
Why is it that I gotta, myself
like,
as a physician has to be in a...
Right. You don't want me to share the schedule that I have?
Come on. Or the antibiotics?
Right.
What?
It's on the hush. Don't tell him about that Zosyn.
Don't tell him.
Don't tell him about that
Zosyn. It's piperacillin here. Like, get out of here, man. Anyway, we're going to talk about that, so.
Yeah.
But let's jump into self-care. Self-care while working. This is a big deal. This is huge for you. This is huge for me.
This is huge for a lot of docs out there.
Yeah. So we're not going to talk about it from a sense of burnout, but we're going to talk about like what I do, and you can chime in, or if you have a list. I made some notes as to what I do to kind of make sure that self-care on a daily basis is something that I'm thinking about, because I think that's the way that you have to think about it. And this is from a resident even to where I'm 10 years out, over 10 years out. Self-care is something that you got to think about on a daily basis. You got to make moves. You got to practice this stuff every day. Otherwise, the joke's on you, because that stress of being a resident, that stress of, wanting to take some time off and you feeling like you're the only person who can do that, or, you being an attending and your partners may not be centering this stuff. Like, you have to have the strength. You have to be able to just say, hey, look, I don't care what anybody says. I'm going to do me. So I'm going to start with my number one thing that I do.
What?
To make sure that self-care is very important while working. And that for me is working out. I think that's easy. That's no joke.
Yeah.
For the past 2.5 years, y'all, I'm telling you, I've been getting my Billy Blanks on. I've been getting my, what's that guy, Richard Simmons?
Know who Billy Blanks and Richard Simmons are anymore?
Royce, it's sweating time.
And Sizzle. Yo, I've been getting all that shit on. Who's the other guys? Sean T. And now I got like virtual private training now with the Future app, which is a great app. But for me, working out is huge. I'll leave it at that. So, and it's big for me because I feel like decision fatigue is real, right? Particularly for surgery, decision fatigue is real. And like, I'm not trying to toot our, surgery's own horn, but like we get involved in so many decisions for so many different services, and that everybody asks you for a decision or to make a decision about
what should I do with that?
It depends.
And the implications of those decisions are always weighing on you.
And it's just like, who should you operate on? Who should you not operate on?
Who should you send home?
Who do you need to check on later on? How quickly should you check back on them? Can you send somebody from the ED? It's just so many different things. And I think for me, when I finish my 12-hour shift, as soon as I get home, or even before I go to work, for an hour to an hour and like 15 minutes, me just working out, and there's nothing on my mind except working out. And the workout is already made for me. All I got to do is follow the app, or prior to that, all I had to do is just pop in the right video, and that's it. Like, there's no decisions that need to be made. It's all ready for me.
Right.
I love that, and it goes even beyond just saying, okay, you're following something, you're making your body better. For me, it's like, this is almost like therapy for me. You know what I'm saying? Like, this is quiet. Nobody can get to me. I love it. So for me, it helps me to focus. It keeps me in the center.
So you think that, not you think, I mean, you're obviously doing it.
Yes.
But I guess like the question is, with as much decision fatigue as you have, like, how are you mustering up the energy to then go energize yourself with exercise? You know what I mean? Like,
yeah.
Like you get so tired, you're just like, ugh, forget it. I'm just going.
The way how I look at it is, by the end of the day when I'm ready to sleep, I always will think about how crazy the day was. But I always can say, well, it could not have been that crazy because it didn't beat me down enough for me to not work out.
Right.
So that's where I'm at right now. So now it's like, well,
although you didn't work out yesterday.
Well, yesterday was a travel day for me, and today, which is the next day, was supposed to be a recovery day.
Right.
So for me, I was like, well, by the time I get home, it's going to be 7:00 at night. I really want to put the kids to bed. I really want to spend time with you, watch that Gerard Carmichael show. The show's dope.
Yo.
The show's dope.
Yo.
I really wanted to do that. So rather than have the pressure of, and we've tried that once where I'm working out in the living room, sweating and watching, a TV show, and then you're watching, it doesn't work. So that's why I took that day off.
Right.
But today I just switched the days. But yeah, like for me, that's the way I look at it. It's like, no matter how much you can beat me down, you got me for 12 hours, sometimes a little bit more too. It was front, not to front. Right. But I just know that it doesn't matter. I'm going to center myself sometime during the day.
Yeah.
And that makes me feel good. That's how I justify it all.
Yeah,
yeah, you're going to cook me for 12 hours, but I'm going to get mine. And I'm gonna cherish
it has to end at some point.
Yeah.
It's like, it's like starting a race. The gun goes off and you're like, well, I got to get to the finish line sometime.
Yeah.
I got to get to the finish line sometime.
It's real, man. It's real.
Is. For me, so I'm
I didn't ask you for your.
Yeah, well, I'm telling you. But I'm line stepping. I'm very different from you in that respect. Very different from you in that respect. So the way I work is very different than you also, right? Is that when I work,
I think the way you work is crazier than the way I work.
But I prefer to work that way. But I work from Friday 5:00 to Monday 7:30 in the morning. Yeah. So Friday 5 p.m. to Monday at 7:30 p.m. Excuse me, 7:30 a.m.
There is no day shift. There is no night shift.
No, there's just me.
Yeah.
That's the shift. That is the shift. So for me, I have to always be very mindful of the fact that my day can look any which way at any point in time, and I'm going to be the one to be called and the one to be responsible for making all of those decisions, doing all of the procedures, coming in, writing the orders, doing all that stuff, right? Like, and there isn't like another person, right? Like I don't have PAs.
Yeah, that's the thing.
Right?
Yeah.
Like, so you have PAs. I don't work with a PA.
Yeah.
Right? Someone who can write the notes, see the patient.
Discharge.
Right. Discharge, do all of those things. So I don't have those things. So I have to be very mindful. And so I don't know if you would call this self-care for me. I really don't. But for me, what I like to do is when there is downtime, I take my downtime. And that could mean take my downtime any which way I want.
John Wick?
Yeah.
John Wick. That's one. Yes. Rush Hour.
Y'all.
1, 2, 3.
The TNT channel be on lock. Okay.
Sometimes my downtime, honestly, is I just need human interaction that isn't necessarily going to be clinical. So I might call somebody on the phone, or a lot of times, actually, I'll just go shoot the breeze with the nurses, and we won't be talking about patients. We'll be talking about just about anything that's going on and just laughing it up, talking about the dog, talking about who went on vacation and, X, Y, and Z. So that's kind of how I get my mind ready to be able to say, all right, I've vegged out enough. Now I'm ready to make another decision.
Okay.
There isn't like this intellectual constant revving of the intellectual machine. Mm-hmm. So I kind of just chill out that way.
Is nothing else like, is there like something, a certain type of food that you eat, or do you always try to get a nap?
No, actually, I indulge myself.
Do you go for walks or anything like that?
Nah. I don't do none of that. Listen, what I do...
She's like, none of that fill my cup shit.
No, none of that fill my cup. Listen, what I do, people would not consider self-care, but it's not up to them, right? It's not for them to decide what my self-care is.
Trading places, 48 hours,
No, Trading Places. 48 hours, not so much.
Okay.
Trading Places, yes. That's my favorite movie.
I can see! I have legs!
Yo,
Damn, I just gave away a password.
The stuff that they... the stuff that they say in Trading Places, they could not say nowadays.
Oh man, yeah, that's a.
All right, so Renee likes to yuck it up. So you like to have like personal conversation that's just like,
or I just like to watch.
Who won Kendrick Lamar? Did you see which housewife whoops which housewives at? That type of stuff.
I don't watch Housewives, so
I know. I'm making the point because you made such a big deal about it, like 3 episodes about it.
I know, but anyway.
Speaking of, someone said they got beef with one of them. Said they had beef with you on social media.
Good.
Yeah.
Bring it.
Yeah.
Nobody said they got beef with me on damn social media. Please.
No matter where you are in your career, you've seen patients your age or younger get seriously injured, have a long-term illness, or even have a mental health issue that affects their ability to work. Now, what if that was you? No, for real. What if that was you? Without disability insurance, how are you going to replace your paycheck? In episode 176, Jamie Fleischner of Set for Life Insurance explains why the best time to buy disability insurance is during your residency.
Most physicians acquire their disability policies during residency, and there's several reasons. First of all, when you're younger, you're able to obtain the insurance because they ask you a whole host of medical history. And so you usually don't get healthier over time. Usually you get less healthy over time. So when you're healthy, it's easier to acquire the coverage. Number 2, it's also less expensive because it's based on your age and your health. You're not getting younger or healthier over time. So you're at the ideal time. The earlier you get it and the younger you are, the less expensive it's going to be.
So whether you're a resident or you're an attending, it's never too late to protect your income. Renee and we use Set for Life Insurance to find a disability policy that fit our needs and budget. So what are you waiting for? Check out setforlifeinsurance.com. Once again, that's setforlifeinsurance.com.
Point number 2 with me. And as you guys can all tell, therapy. I need therapy. But I do therapy, yo. Therapy is key for me. And therapy can look a lot of different ways for a lot of different people. For a while, therapy was this podcast, right? You can tell just by listening to the show from the first time all the way up to like several years into the show. Like I literally was getting some shit out. But
what were you getting out like that?
I don't know. You have to go back and listen to it. Go listen to it. We need to download numbers.
Ain't got no recap?
No, right? But
that's in the past.
Using a therapist for me has been great, right? It's helped me to understand like my blind spots. It's helped me to understand things that like I just need an explanation, or I'm looking for an explanation as to why. But I think that's dope, and it's like we had BetterHelp on the or we had BetterHelp as a sponsor. I didn't go with them, but therapy is great. It's a good thing. You learn new vocab like trauma and, this is my
You're
safe
a trauma
space.
surgeon.
I
You
know.
didn't know that term?
Gaslighting and all this other BS and stuff. I'm like, yeah.
You can get that from social media.
I know.
I'm literally gaslighting you right now.
I know. But, several years ago, I would have came at you. You know what I'm saying? And you see where therapy has brought me?
Woosah.
You see, I'm in a brighter place, Alfred, right? I'm in a better place,
A higher level.
I'm in a higher level, right?
Growth.
I don't explode anymore like I used to, right? So, yeah, therapy is great. So using a therapist to kind of talk things out works for me. And I don't mind telling people about it anymore. It's just like, that's what it is. That's what I do.
Did you mind telling people about it?
Yes, in the past I did. I was like, I ain't trying to talk to anybody about it. But now it's like, look, I need a therapist every now and then. It's all good to chat, and make your moves and go from there. Don't judge me. Let me know at 833-230-2860.
Or judge you and you don't care?
Yeah, I don't care. I don't care. Number 3, something from residency. Check this out.
What?
This is something.
Hold on. What from residency could possibly be self-care?
Well, this is not self-care from residency, but this is a vestige from residency that I had to learn to stop. And this is where therapy comes in. Berating myself. Right?
You're a berater.
Oh yeah, berating yourself. You that's part of the survival mechanism, right? You kind of berate yourself in anticipation for what your attendings are going to say about you, or what someone else is going to say about you, and that kind of motivates you to make sure that you don't make those mistakes, or motivates you to stay up a little bit longer, or motivates you to come in earlier so that you can, make sure that you jump ahead, like you're playing chess. It's like, oh yeah, you can't say that I'm late because I'm getting here like 9 hours before my shit starts.
So no, this is a very interesting concept to me. Berating yourself, like what does that look like? And the reason that I'm asking is
what it looks like, anything that goes wrong is your fault, right?
So you just kind of blame yourself.
Yeah, right. And it doesn't even have to be like anything tragic. It just could be something like as simple as, even someone pointing out something to you that is not that big of a deal, but the fact that they pointed it out to you, you go back and like attack yourself. Why did I leave myself open? Like the potassium, like everybody know, not everybody, but a lot of people who don't know, like in the intensive care unit, we try to keep potassium at 4, we keep magnesium at 2. We
keep the orthopedic docs taking notes right now.
Ortho, actually, just tell them to chill.
They taking notes.
Just put your notebook away.
They taking notes.
Put your notebook away.
And they're like, okay, when are you going to get to the hammer? There's no hammer. Look at them. Ball it up.
The hammer and blood. You're going to get the orthos mad at us. But what y'all going to do anyway, please?
I'm going to get the orthos mad at you. You talk about them all the time.
No, I don't.
All the time.
No, I don't.
Anyway.
No, I don't.
So, no, the reason that I was asking is because, I think that, so berating yourself might look normal to people, right? They may not even realize that they're doing that. They might just think, well, I'm being self-reflective. I'm not actually berating myself. So what's the difference? Like, how did you know?
Like in your mind, dumbass, why did you do this? Or, someone could die off of this. And it's like, okay, today their potassium is 3.8.
Ortho, is that bad?
You know what I'm saying? Like, it's certain things that are just like, they're not that big of a deal. That is just like, hey, you okay, yo? Like you having like 9 different conversations.
No, I'm just laughing at ortho.
So it's like it's just a I think it's a thing that a lot of people go through, whether it's berating themselves or some people want to call it imposter syndrome.
Okay.
Or it's a form of imposter syndrome.
Okay.
But basically, it's a way where you're thinking that you have to be perfect in order to get good outcomes. But as we all know, like medicine will like very much humble you. Like you can do the same procedure 100 times, and that 101st time will just be something completely different where you're just like,
yep. As they say, if you don't have any complications, you're not doing enough cases.
Right. So that's kind of where I've learned to just chill out with the beratement of myself and realize that, you know what, for the most part, I'm a part. First of all, I think the key thing is just understand that we all are a part of a system, right? We're part of this large system. This, like, let's be real, like we are cogs in this wheel.
Right.
And in essence, like the system of how we practice healthcare in the United States catches a lot of people, takes care of a lot of people. And yes, you can make a mistake that, causes someone possibly to pass away and die and so forth. But in essence, you got to remember that, look, like we all are trained very well. If we make a mistake, it's usually not on purpose. And for the most part, it's not a major mistake. And I think for me, that's when I've just been like, okay, listen, like the insulting is not necessary to me. Like the perfection is not necessary. But yeah, like I check on things and I check on things and I check on things and I make sure that I don't miss anything because I always treat that person like it's a family member and so forth. Right. But yeah, I mean, this internal discussion that nobody else knows is going on, that's what would go on for, significant time after residency.
So how'd you get over that?
I just stopped giving a fuck. And I just started realizing that I was trying to, like, the driving force for me several years ago was not the patient, it was my colleagues.
Right.
And
the
once
people pleasing.
And once I realized that was stupid, you're never gonna please them anyway. Right. So why are you trying to please them in the first place? It was just like whatever. It is what it is. Like and you start realizing, because then once you get over that and you start realizing, like, oh wait, I see what happened. You've been covering your mistakes by doing A, B, C, and D all the time. It's just that you're just highlighting mine or you're just highlighting somebody else's.
Deflect.
You're deflecting. Now I get it.
Right.
And now I'm just been like, yeah, like,
Yeah.
I didn't check on X, Y, and Z, but that's not that big of a deal. But that's what your job is too. Can we move on, guys? Like that's kind of how it is. Like for particularly in surgery sign out. Like it sometimes can be very malignant, and just I've just been like, hey guys, like I don't know that answer, and I don't think it's that big of a deal. Now that you're on, you should check on it.
Right. Since you got that question, you research it and
you look it up and move on with a smile.
Right.
See you later. And you could tell it burns them.
You don't think that that's its own level of toxicity?
Yes. Sometimes you have to. Sometimes.
Hence number 2 to therapy.
Sometimes. Yo, you remember that episode of what's that episode? That episode of Atlanta. Hey, yo, with my dude right here, when he got burned at the airport, and he created that entire facade for that TSA
ruined that
lady?
woman's life.
Ruined
that woman's life. Yeah, I think. I think that's really interesting because I think, especially if you are a resident, if you're listening to this, or you're a very new attending, and you do have that uncertainty about yourself, right? Because you're either training or you're just out of training. That self-reflection is one thing, but self-beratement is another. And I think there's a fine line that you won't even necessarily know when you've crossed over that line. Yeah. Because as you're talking, I'm thinking about myself as a resident. I'm like, did I have that? I'm like, I don't even know. Like, I actually don't even know. I remember one time I was on the MFM rotation. And
can you let people know? Some people don't. Some people don't know what that.
Yeah, it's maternal fetal medicine or high risk obstetrics. Rotation.
Why do they call it that? Why don't they just say high risk obstetrics? Why do they say maternal fetal medicine?
Because you're taking care of the mother and the fetus.
But isn't that just general OB?
Listen, that's what I didn't vote.
That's why I said why don't they just call it? Anyway.
I don't know. So I was on that rotation, and my cool attending, Wendy Kinsler, she was cool. I really liked her. Learned a lot from her. And I remember I was on the floor one day and I was looking at something in the computer, and I must have looked intense. Because soon as she
potassium?
Huh?
Was it someone's potassium?
No. But I must have looked really
magnesium.
intense. Somebody's magnesium.
Is there magnesium 4?
It was 7.
Okay.
So I must have looked really intense because when she walked onto the floor, I could hear her, and she goes, "Look at her, look at her." She said something to the effect of like, "I look so intense, like I'm in this thing." And I never forgot that moment. It was just a small moment, but I never forgot that moment because I was like, how did she know that I was so like, that I was just so like intense into this thing? I must have been thinking something that made me so tense, and it like basically made me behave in such a way where she actually noticed it. You know what I mean? And it was amusing to her, but it just made me think, like, was I at the point where I felt like, no, I gotta get this right. I got to get this right. And I was in my head thinking that while I was doing whatever it was on the computer, such that she even noticed, like, dude, like, you look intense.
So I think as a resident, there's certain, when I'm mentioning these things, guys, like there's certain, you got to have a certain amount of leeway, right? Because as a resident, there's so much that you're not in control of. Mm-hmm. And you look for control in the things that you can control, which is taking care of patients, getting there on time, replacement of, rounding. These are the things that I got to be very, like, they become very anal about that stuff. Right. So, particularly when it's so uncertain, in some residencies, you don't even know if you're going to be moving on to the next year or not. So you're like always on stress, right? Like you are on one all the time. So I definitely agree with what you're saying. Like you could be very intent for whatever it may be reasons. Mm-hmm. As a resident though, like I tend to kind of just like, I don't like when people say, just chill, you're going to be all right. Like, yes, you are. But like when you're an attending and you're talking to a residents ain't trying to hear that shit. Mm-hmm. They're like, listen, man, I'm just trying to get to the end of the day. I need a good recommendation or I need a good grade.
I need to finish.
Like I don't need you to like tell me like, yo, like in 20 years it's gonna like shut up, man. But yeah, I see what you're saying. I think as an attending though, when you are dealing with a lot of stress or you're dealing with a lot of situations where you just don't know, right? Because that decision fatigue is real. Mm-hmm. And I think one of the things that I have in my notes that I wrote is, particularly where you're at, like if you don't have a lot of help, you can feel like you're all alone.
Right.
Right. And I think the key thing is that you can't clone yourself. Right. You can't be in multiple places.
Right.
You can only prioritize what's the most important thing and you can't take care of everything. So if they're calling you for so many different things, it's like, yo, like everybody take a chill pill. I'm just going to prioritize this.
That's tough though as a resident.
Well, listen, but that's why I said there's certain things from this that you got to take away. Mm-hmm. I'm talking to the attendings at this point right now. Right. Because as a resident, yeah, it's tough. But even as a resident, you still got to triage, right? You still got to prioritize, right? Because what's going to happen the next morning or what's going to happen, when you're talking to the attending and you're telling them about all these different things, they're going to be like, yo, don't give me everything. Triage the most important things that I got to know. Mm-hmm. And then you're going to be kicking yourself in the butt like, wait, you only want to know like the pertinent positives?
Right. But I mean, herein lies the problem, right? Is that if you're like me and you encounter an attending who essentially is like out to get you.
Yeah.
And now the little thing that you thought, yeah, that's not a big deal. That's the thing that they want to know. Forget about all the other big things. They pick the smallest thing and they're like, no, I wanted to know that. Why didn't you know that? How do you you see what I mean? So that's why I'm saying, is there a fine line? Which I think there is, between self-reflection and self-beratement.
So what's the fine line?
I mean, I think that it's hard to tell. Mm-hmm. I don't think that you actually know, or not everybody knows. Like I said, I don't know if as a resident at some point that I wasn't self-berating. So I think my first year of residency.
If you had a resident right now calling you and saying, hey, Dr. Darko, I need your assistance with this. I'm in a program that's X, Y, and Z, and I'm getting to residency I'm starting my days at 4 a.m. and I'm leaving by 9 o'clock at night. And like I'm on my stuff, but like, yo, my cholesterol's high, my stress is high, I'm estranged from my family, all these different things. What you gonna say to them?
Just chill. No, it's gonna be all right. No, I mean, I think at that point.
You see what I'm saying, though, right?
No, I know, but that's what.
Because you got to. There has to be something that you could tell people to say, "Hey, listen, like, first of all, like, I see what you're going through. This shit ain't right, and I get it. 20 years from now, you're gonna be like, yo." But for me, like, there's got to be something where you got to give them some type of tips, and that's why I'm saying, like, at this point, like, you got to prioritize what's the most important thing, right?
Obviously, but I'm gonna tell you, sometimes the most important thing is in such competition with the thing that is also extremely important. So the thing that is most important versus the thing that is extremely important, which aren't always the same things. The thing that's most important is your health. The thing that is extremely important is you finishing this residency. And those two things are competing. Like, that's a problem because...
Wait, the thing that's important is whose health? The patient's health?
No. The resident's health.
Okay.
Right? Like, my health as a resident is going to be important because if I drop dead, ain't no residency, right? If I have a mental break,
oh well,
ain't no residency. But the thing that's very important
maybe
to
if you're
me,
a third or fourth year, yeah.
But the thing that is very important to me is finishing this residency. And so that also piles on to, you know, if I don't finish this residency or if I do something to piss somebody off, then how is that going to affect me? Because I really want this thing. I want to finish. So that, you know, for me, I think like, and it's not that I disagree with you that, you know, you shouldn't berate yourself and things. Of course you shouldn't berate yourself. Like that's not healthy. And that honestly is just not humanly normal, right? Like self-preservation is actually the first law of nature. So
Correct.
If you start berating yourself, you're actually your own enemy.
That's what I'm talking about.
Yeah.
Right? That's what I'm talking about.
Yeah. No, I agree with that. But I just think it's such a tough dynamic.
Well, I've been in situations as an attending where like I felt like there's just so much decisions that need to be made on so many different people that there's times where I'm just like, I tap out. Like, you're gonna have to transfer this patient to another facility. You're gonna have to go here. You're gonna have to go there because me as one person can't deal with all of this stuff. There's come to a point where I was like, look, this is too much. I know people right now who are probably listening to this show who don't even know that, or they know that and refuse to do that. And I'm like, yo, like at certain points, like your ego is hurting a patient. You know what I'm saying?
Well, yeah, it's not just hurting a patient, but it's hurting you, and it's hurting your entire program, your entire service.
Well, most residents don't really. They don't make the decision to transfer. I'm talking to the attendings right now.
Yeah,
so.
That's what I'm saying.
Yeah.
But that's what I'm saying. Your entire, when I say program, I'm not just talking about residency program, but I'm talking about like your surgical program or whatever, right? Like to take on patients that you know that other people on your service cannot handle. So for you guys, right, that might be bariatrics, right, for example, right? So bariatric patient comes in, says, I have abdominal pain, I got this issue, blah, blah, blah. You find out, this person needs surgery, and you're like, can't handle that here. That's not what we do, not at this particular facility. You got to go. Other people might be like, nope. Bring them on, put them on the OR schedule. And by the way, my partner's going to operate on you tomorrow. When you know that partner doesn't do bariatrics, you know this, but you're going to do it anyway, right? Like that's the equivalent of me starting an induction.
Yo, this is why I don't tell you shit, yo.
Right? No, but it happens. That's the equivalent of, so we see this in OB with VBACs. Right? Or TOLACs, right? Trial of labor after a C-section. There are people who are like, listen, I don't do VBACs. Like, I just don't do that. I personally do VBACs. I don't have I was a VBAC baby. I do VBACs. I don't have a problem with doing VBACs. But if I'm ever at a facility where people don't do VBACs, but technically the facility can handle VBACs, then technically I can make the decision for myself whether or not I want to labor somebody who's had a C-section previously. But do I do that knowing that my partner who is coming on doesn't do VBACs? And so when this lady doesn't deliver on my shift, I'm like, she's your problem now, Campbell. Do I do that?
Yeah.
Right? So, these are the things that sometimes people will do that sometimes I think you gotta wonder why.
Be very clear to nursing staff. Be very clear to your colleagues. Be very clear to consulting physicians what you can't do, or what the concerns are, and that's it.
Clear communication is definitely self-care.